Kia ora, good afternoon and welcome to the Rural News. I'm Maya Burry in Christchurch. The New Zealand shearing sports season is over with the cancellation of 9 competitions which were scheduled for the next 3 weeks. The cancellations include 6 AMP shows and the National Shearing and Wool Handling Championships, which were set to take place in Te Kuiti at the start of next month. Shearing Sports New Zealand's chair, Sir David Fagan, says this is the right move, especially given the government is set to announce further restrictions on mass gatherings today.
Each show committee's made their own individual decision, really. It hasn't been Shearing Sports New Zealand done it. I'm part of a big committee here that run the New Zealand Shearing Championships, and we met on Monday and then again Tuesday night to make a final decision on what we do. We could have possibly run the event under 500 people, but with the feedback from the community, the friends and family, and I think morally we just couldn't do it because the risk is too great. And then you see every other sporting event and equestrian, everything being cancelled. Shearing competitions are great to have, but in this case, in this year, we just needed to step aside.
So that pretty much wraps up the competition season for the year then, does it?
It does. There was about a month left, and there's probably 4 weekends of competitions throughout the country. The biggest one, of course, being the New Zealand Shearing Championships here in Te Kuiti that we're on in a fortnight's time. An iconic event that's been going since 1985, so pretty hard to not have it, but yeah, it just had to be done.
That's Sir David Fagan. He says the cancellations will come at a cost to event organisers. Synlait Milk says despite some moderation in milk supplies due to a dry season in both Canterbury and Waikato, the dairy sector is holding up. The company reported a 30% fall in its first half profit, but this was due to its own rising costs and it did bring in more revenue. Synlait's chief executive, Leon Clement, says it expects no major impact to business because of the COVID-19 pandemic, and he says its milk price payout remains unchanged.
We're seeing dairy be largely resilient to some of the impacts of COVID-19 and prices are holding up pretty firm. Recent auction just this week, we saw a little bit of moderation down of whole milk powder and skim, but fat prices seem to be holding up. So at this stage, we're holding that forecast at $7.25. Obviously quite a bit of uncertainty around at the moment, so we'll just have to see what happens. In terms of our own supply chains, we obviously source materials from all around the world, and look, we're making sure that we move proactively to ensure we secure those so that our plants can keep running as we move forward with this increasingly uncertain situation.
That's Synlait Milk's chief executive, Leon Clement. Sales of tractors and farm machinery dipped last year, according to new figures from the Tractor and Machinery Association. Sales of grass and forage harvesting gear fell nearly 7% in 2019 compared to the year prior. Meanwhile, tractor sales dropped more than 13%. The association's president, John Tulloch, says the fall did come off the back of a very strong year in 2018, and he says it could have been worse given the worries facing the farming sector.
Well, just a lack of confidence really in the business sector. A lot of uncertainties around government policy and also the new equity requirements that are coming into the banking sector. That's meant that quite a lot of decisions have been put on hold until people can see their way clear. So for those reasons mainly, we've had a little bit of a holding back on decision making.
Meanwhile, Mr Tulloch says 2020 is shaping up to be another uncertain one.
Okay. Right, everyone, we'll start with just a few opening remarks and then happy to take any questions on any topic. Look, this morning was a chance for us to meet directly with some of the businesses here in Rotorua who are most directly affected by the global impact of COVID-19 here in New Zealand. We had represented in the room today many tourism operators, those who are in forestry, hospitality, and even those who are servicing those businesses. Some really clear messages came through. One is that those businesses absolutely understand the moves and measures that have been taken in order to protect New Zealanders' health. In fact, in their view, that was the best way to try and support their business in the long run. That for me was heartening to hear. That has been our strategy, and they reinforced the importance of that strategy in their comments today. The second message that came through from multiple businesses was that the support package we announced this week will make a difference to them. It's giving them certainty, they can plan around it, and many commented on the fact that it meant they had been able to save their staff. We then talked around additional opportunities, for instance, for those who are keeping staff on, whether or not there are training opportunities, the chance of redeployment and other initiatives which we will continue to explore. You'll know that we looked at redeployment options in Tairāwhiti and formed a package. We'll be looking to do the same here in Rotorua. So that group will meet again. We'll bring together economic development agencies locally, local government and the Chamber of Commerce, alongside the Ministry of Social Development and our work brokers to formulate the same kind of redeployment package that we have done on the East Coast. The third message that came through strongly was for banks and other corporates. We as a government are doing as much as we can to support particularly small and medium-sized businesses. Their request was that banks and those, for instance, that may owe them money through bills, who are often larger organisations or who they may rent their premises off, play the same kind of role that we as a government are. That is, work together, support one another, help each other through this very difficult time. This is going to take all of us, and so my message on behalf of them continues to be to those groups, we are all in this together, and so we need to support each other, and it takes every single layer that helps a business operate to play ball. The fourth point I just want to make is a more general one. I've been watching for some days, and this is not unique to New Zealand, that in the midst of what is a global issue, as you would expect, there are a number of rumours that circulate. I am present on social media, or I see it myself. I cannot go around and individually dismiss every single rumour I see on social media, as tempted as I might be. So instead, I want to send a clear message to the New Zealand public. We will share with you the most up-to-date information daily. You can trust us as a source of that information. You can also trust the Director General of Health and the Ministry of Health. For that information, do feel free to visit at any time to clarify any rumour you may hear, covid19.govt.nz. Otherwise, dismiss anything else. We will continue to be your single source of truth. We will provide information frequently. We will share everything we can, everything else you see, a grain of salt. And so I really ask people to focus on that.
A egregious example of that appears to be this text which originated in Malaysia and has become a viral hoax in Australia and in New Zealand. How responsible is it that people are sharing that news of a lockdown imminent in New Zealand?
Yeah, and look, that's the kind of thing that adds to the anxiety that people feel. So I continue to share the message. New Zealanders must prepare, but do not panic, prepare. And when you see those messages, remember that unless you hear it from us, it is not the truth. And I really ask people, just visit covid19.govt.nz. It has all of the up-to-date information, and we will continue to provide everything you need to know.
Can you talk more about the level of anxiety that the country's kind of facing at the moment and how that kind of fake news can promulgate that and make it worse?
Yeah, we are in an unprecedented global situation. Every New Zealander I know will be feeling a bit of anxiety. They'll be looking abroad. We're not alone in that. The world is experiencing this right now. But I want to again just share that the last thing we want is that anxiety to be based on misinformation. You can trust those sources, covid19.govt.nz, and I'll be giving daily updates, ministers as well. Tune into us. We'll keep sharing what you need to know.
This morning on Air Force flight, you're not flying commercially.
Well, no, that hasn't been a firm decision of mine, but there were multiple reasons today when we took that form of transportation.
What were those reasons today?
Of course, always when we are flying into regional New Zealand, timetabling doesn't always suit scheduling.
Are you starting to take further precautions, though, as Prime Minister, to isolate yourself from the risk of COVID?
As you can imagine, I'm standing before you giving a message around the importance of social distancing, and I'm, of course, trying to adhere to that myself. It was, yeah. And look, these are one of the messages I'm having to share with everyone. We do need to take social distancing really seriously. I need to make sure, of course, that I'm still available and able to do the job I need to do on behalf of New Zealand, but so do a lot of key workers. So social distancing is really important.
Prime Minister, can this town survive if people don't come here?
Well, one of the discussions we were having today is what we can do to make sure that those workforces who have traditionally relied on visitors can see through and see out the other side of what is a global issue, but one that's hitting Rotorua hard.
Because this town also has a big level of homelessness.
Yes, it does.
And if people lose their jobs, a lot of them wouldn't be that far off from living on the streets again.
Well, of course, what we've been working on are making sure that the support mechanisms exist. So regardless of whether your hours are reduced or whether you find yourself made redundant, that not only do we have supports in place, but we also have hope. We have training, we have support mechanisms that give you other opportunities, because that is so important at this time.
You said yesterday that you wanted more people to go into self-isolation. We've noticed a lot of people wandering around town who came in here, who are just wandering around, and they came in, say, a week ago.
Yes, and for everyone who has come in even before, but the 2 weeks prior to the announcement of those border restrictions, we have asked to see out their time in self-isolation. For those who have come after, we are enforcing, and you will have seen that we are not afraid that if people aren't willing to operate within the rules, we will take measures like deportation.
There's still a lot of tourists wandering around.
Yes.
Who came in before that?
I won't necessarily make assumptions about their travel plans and so on, but the message I send is very, very clear. We take the health of everyone who is in New Zealand very seriously, and we expect them to as well.
Was there any story you talked about needing to treat this like a civil defence emergency, so civil defence emergency? Does that suggest that we're moving towards declaring a state of emergency?
It suggests that, like everyone else around the world, we are taking steps to make sure that we protect New Zealanders' health. That means that at every step we have moved early, because it's all about trying to stop these waves of cases. And so part of moving early means making sure everyone is prepared. Prepared if you need to work from home, prepared if you need to cancel social events and so on, and cancelling non-essential travel. I need New Zealand to prepare for that.
Was there any talks of declaring a state of emergency?
Again, I think everyone in the way we're operating at the moment can see that we are in a very heightened state as a nation, so is the world. We are in the middle of a pandemic, and so this level of preparedness, whether you have a declaration like that or not, is what I expect of New Zealand. Yeah, I'll just stand around.
Was there any talk this morning among the key tourism operators about having to shut down for a period of time while we go through all some of the bigger ones that attract larger crowds?
Each business has their own plan and has some of their own thinking around what they can do if they're planning to keep on their staff, how they can keep them employed. And I don't just mean in terms of income. I mean in terms of their mental well-being, making sure that they feel like they're doing something that's contributing, that they're either upskilling. Every business down there I could hear already had plans around that. What we want to do is make sure that we're supporting that as much as we can.
It was interesting too to hear some of them talk about the things that they could do for each other that weren't even so much about business, but actually just about looking out for each other. You know, there was a bit of a conversation from the Zorb company saying that our package meant they could keep their staff on, but even if they didn't have customers, they were going to go out and mow the lawns of some of the other businesses. So you've got that kind of community spirit, which I know Rotorua is famous for, coming out. So it's not just about the business itself, it's about how they can help one another.
Yeah. Travel to the Pacific?
We are keeping constant contact with the Pacific Islands, and of course so far our measures that have excluded the Pacific have all been because of no cases there, but we've equally been mindful about visitors going into the Pacific. If things change, we need to be ready to change.
Now that Samoa has its first suspected case and it's still reeling from the measles outbreak, should we consider banning travel to Samoa?
Of course, keeping in mind that they also, it is also their decision to ban travel too, and so I'm mindful that these are their decisions, but if that is one they make, we will support them. We are very mindful of the responsibility we have to our Pacific neighbours.
How far off are we from closing?
The government look at providing assistance for New Zealanders who might find themselves stranded overseas?
Oh, well, obviously the Ministry of Foreign Affairs and Trade has been very clear on their advice. You can see that airlines are changing up their scheduling. Availability is dropping away. Some people will live overseas and ultimately they'll be making their own decisions. But MFAT has advised that those who may be midway through a trip, who are only out of New Zealand for a short time, to make an assessment about whether or not they want to stay or whether or not they need to look at the availability of their flights.
Have you talked to Australia about New Zealanders who might lose their jobs over there, who can't get welfare payments? Have you talked to Mr Morrison about that?
Not that specific, not within the context of COVID-19. You'll know that I've raised it many, many times generally.
Where are we at in terms of preparation for repositioning facilities, other equipment and things if need be?
All part of the pandemic planning, so all things that have been underway for some time. That's the kind of stock taking that we do across the board, as you would expect in a situation like this. Well, we've got a range of different options and they do exist within the health system, but also within wider government facilities and wider health facilities that exist in other places, like for instance the Defence Force.
At what point do you start shutting down schools?
Well, we've been really clear on our guidance around schools. You will have seen in Dunedin we had a case there, and when we've had a case, that means we shut down for 72 hours. We contact trace everyone that person has been in contact with. They self-isolate, the school is cleaned and then reopened. If we have wider community outbreak, then we reassess that strategy.
You're talking about getting ahead of it though, so isn't there an argument to start shutting bars and restaurants and schools now?
My message to every New Zealander is if you can't be apart when you're together, reconsider. We have to, no matter where you are, whether it's the workplace, whether it's university, whether it's out and about, we must make sure that we're keeping our distance. And that definitely means hongi, hugs and handshakes, but it's much more than that too.
We've seen with that case in Dunedin a huge number of students who have come into contact with a sick student because it's so hard for kids at school to isolate, or distance themselves socially. Isn't that a reason maybe we should consider stopping school, stopping university?
Again, what we've been basing everything we've been doing is around the public health advice of our ability to keep contact tracing. If we see wider community outbreak, then you do things differently. But right now, because of what we know about the way this transmits, what happens when you're asymptomatic, and what we even know about how long it can survive without cleaning, we can make really sound evidence-based decisions. But we have always been willing to change those decisions if we need to escalate.
How many New Zealanders do you think might catch or get the coronavirus?
Ultimately, it depends whether or not we are going to be a country like Singapore or whether or not we're going to be a country like those we're seeing in Europe. We are working very hard to be a country that can still contact trace everyone who's been in contact with a COVID case. Those are the countries that are being successful in containing COVID.
The meeting that you had this morning, would you warn people about being in such close quarters as that?
I did stand up at the beginning and say that this is the way we need to function now, and I will keep sending that message to all New Zealanders. We do need to keep that social distance. That's a message. You'll see that I was trying to fan my arms out at the beginning of the meeting. This is new information for many people. We need to keep repeating it. There is a reason that we have put an end to those mass gatherings. It's because of how difficult it is to manage social distance. So if you can't stay apart while you're together, don't get together.
If you fanned out your arms now, you'd be touching a lot of people.
Yes, so you guys all need to back up. Yes. As much for you as for me, I should add. And that's the other thing. This may feel like it's a selfish act, like you're somehow looking after your own health. Actually, what you're doing is looking after everyone around you. Many of us standing here in this circle, we would be amongst the 80% who will be fine if we have COVID-19. But we communicate, we engage with the group who won't be. And so that's why it's so important. Yes?
Last night. Did you get the ball rolling on that debate back in 2017?
I believe that may have been a trigger for it. I always believed that we needed to take it out of the Crimes Act, and we have.
And what's your reaction to finally passing
Oh, this has taken decades to remove this law from the Crimes Act, treat it as a health issue, as we should. But actually, I would pay tribute at this point to the people who have been working on this for well over 30 years. They're the ones who got it to the place it is today.
What does it mean for women in New Zealand, this change?
It means that it's their decision. Okay, thanks everyone. Stay where you are.
Yeah, stay there.
Break. They don't want to take a break, they just want to work. They want.
Mr Biden won in all 3 states to hold votes, expanding his lead. He says he can bring the party together for the main goal of defeating Donald Trump.
Senator Sanders and I may disagree on tactics, but we share a common vision for the need to provide affordable health care for all Americans, reduce income inequity that has risen so drastically, to tackling the existential threat of our time, climate change. Senator Sanders and his supporters have brought a remarkable passion and tenacity to all of these issues. And together they have shifted the fundamental conversation in this country. So let me say, especially to the young voters who have been inspired by Senator Sanders, I hear you. I know what's at stake. I know what we have to do. Our goal as a campaign, and my goal as a candidate for president, is to unify this party and then to unify the nation.
That's former US Vice President Joe Biden. The coronavirus pandemic is a difficult time for many people, but it's also bringing out the best in humanity. CNN's Martin Savage has more.
These may feel like dark days, with headlines of contagion, fear, and hoarding. But human sunshine still exists. Random acts of corona kindness are everywhere. Like a front porch in Columbus, Ohio, where a young brother and sister put on a concert for a 78-year-old neighbor who had shut herself off from the virus and the world. Dressed in their best, the 6 and 9-year-old delighted their audience of one. In Italy, where so many have died and so many more are isolated, they sing to each other from balconies. At night, voices echo through the streets with canine accompaniment. In Spain, where they're also suffering, to say thank you to doctors and nurses battling to save lives, people step outside and applaud everywhere. In Houston, at Irma's Southwest restaurant, now ordered closed, a couple left something behind, a $9,400 tip. To pay your guys over the next few weeks, the anonymous note said.
This is beyond. I mean, I don't even have words for it. I just really don't.
We have to let our staff know that we may be off for work for 15 to 30 days, depending on how long that is. But the gift we got today should help soften the blow.
At a Cleveland watering hole, also closing, a customer added a little something extra to his less than $30 bill, $2,500 for the staff. When the NBA stopped the games, Cleveland Cavaliers basketball star Kevin Love started thinking about the arena staff without work. He donated $100,000 from his foundation to them, hoping others would follow his lead in their towns. They did. Elsewhere, the elderly are on the minds of many. People offered a grocery shop for those who cannot or may not want to leave their homes. Stores have begun allowing older customers their own exclusive shopping hours to limit exposure to crowds. And when coronavirus concerns prevented her from going into a North Carolina nursing home to show her grandfather something, a young woman stood at his window, simply pointing to the engagement ring. The virus, forcing us apart, seems also to be bringing us together, closer than we've been in a long while.
That was CNN's Martin Savage with that story. And that ends World Watch and Midday Report for today. We'll be back again tomorrow. Thank you for joining us. Mā te wā.
RNZ News at 1 o'clock. Kia ora, good afternoon, I'm Paul Brennan. Qantas and Jetstar are stopping all international flights at the end of the month until at least May the 31st. In a statement this morning, the Qantas Group says it's grounding more than 150 planes in response to the latest government travel advice. Domestic flights will also be reduced by 60%, and its international lounges and a number of domestic lounges will be closed. It says 2/3 of its 30,000 employees will be temporarily stood down to preserve as many jobs as possible in the long term. The Qantas Group says essential Australian domestic, regional and freight connections will be maintained as much as possible. The government has earmarked more than $160 million to help the hard-hit aviation industry in its $600 million aviation sector bailout announced this morning. All border fee increases and reviews have been put on hold for 12 months. The sole provider of air traffic services, Airways, will receive $70 million to help as revenue falls. The bailout also includes $37 million to cover Airways-related fees paid by airlines for the next 6 months. The Transport Minister, Phil Twyford, says the support is aimed to fund services the aviation industry usually pays, including security screening. New Zealanders worldwide are scrambling for flights to get back home before airlines suspend the majority of their commercial operations. Yesterday, the government urged all New Zealanders travelling overseas to come home. A New Zealand teacher and his family are stranded in Guatemala, which has locked its borders for 14 days, stopping all air travel in and out. Nick Mason says he, his wife and 2 children
attending the update today. So I'm confirming 8 new cases of COVID-19 in New Zealand today, bringing the total number of cases to 28. As with the cases confirmed yesterday, these new cases all relate to overseas travel. That's an important point because it means that at the moment we still don't have any evidence of wider community transmission in New Zealand. Public health staff are investigating the travel history of each of these new cases, and that is so we can quickly identify any potential close contacts and ensure they are isolated and monitored for any symptoms. Of the 8 new cases, 2 are in Southland, 2 in Taranaki, 1 in Rotorua, 2 are in Auckland and 1 in Northland. Details for each of the cases, including flight information where relevant. Now, the flight information may not be relevant if the person arrived back in the country and was asymptomatic for more than 48 hours after they flew. But if there is flight information that is relevant, that will be on the Ministry of Health's website with other information as soon as possible. One of the new cases is in hospital, the others are at home and self-isolating. We are obviously alert to all these new cases and particularly identifying any close contacts so we can isolate them, and we are expecting more given the rapidly evolving situation overseas and the number of people who have either returned to New Zealand if they are Kiwis or who have come in from other countries from some of those hot spots, in particular Europe. As we've said before, we will continue to actively identify and test and isolate cases and close contacts to ensure that we prevent further community spread. We're also working hard to ensure that New Zealand's health system is able to continue delivering a whole range of care for New Zealanders from pre-cradle to grave, in addition to responding to the demands of COVID-19. In terms of those new cases, Healthline will be provided as soon as we know with the seat numbers on the pertinent flights, and we will put that information too on our website, so they will be able to confirm with anyone that they call or who calls in whether they are considered a close contact. A reminder that that is 2 seats to the front, the rear and the side, and diagonally in the aircraft. Close contacts will of course be required to undertake 14 days of self-isolation. And just a word on self-isolation. I've talked about the distinction between those who are cases or close contacts and the requirement for quite strict self-isolation at home, because these are the people who either have symptoms or who are at higher risk of developing symptoms. For those who have travelled back from overseas, but are asymptomatic, it's essentially about physical distancing, not going to work or school, not going out and socialising, but of course it's fine to undertake activities like gardening, going for a walk, going for a bike ride. More information is on the Ministry's website. And of course, things that can enable people to self-isolate successfully are asking friends or family to drop around food to keep the supplies coming, and make sure any deliveries are just left outside the house for you to collect. I know some New Zealand companies are now offering a contactless delivery option for all sorts of things, and you can use those services if needs be. Just on the topic of supporting mental well-being, it's important not only to look after our physical health, but also to maintain our resilience and to look after our individual and collective well-being. This is going to be really important, particularly as we see this has been quite a long-term effort over some months. We have initiated what we call a psychosocial response to ensure people have the information they need to be able to take care of their mental well-being. This includes ways of being able to talk around COVID-19 safely with children, and they may be worried or experiencing distress. There is information available on the Ministry of Health's website, and this will be added to in coming days. Physical distancing, this is fundamental to our efforts to reduce community transmission, and we're regularly reviewing our advice on this. The risk is still greatest within 1 metre, but as a precautionary measure, the distance for contact tracing within public health units, that is how we identify close contacts, we're using 2 metres to allow a margin of error there. And of course that's within 1 metre, or in that latter case 2 metres for a period of more than 15 minutes with a confirmed or probable case. And confirmed cases of COVID-19 who are in strict isolation can and should maintain that 2 metre distance, even from others in their own household. Agencies are currently working together to develop the best ways to support physical distancing within community settings, including workplaces. It's one way we can help prevent the spread of COVID-19. And for example, within the Ministry of Health here, as part of trialling our business continuity plans and creating more physical distance between staff, we are going to start with having 1/3 of our people working from home but rotating through from next week. That will reduce the density of people in the organisation and just help test our systems for working at home to make sure our business continuity planning is actually working. All of us have a role to play in preventing the further spread of COVID-19 and protecting our community, particularly older people and those with pre-existing conditions. Fundamental to New Zealand's response is not putting yourself or others at risk. If you are unwell, please don't go to work, do not send your children to school, and not travelling if you are sick. We all need to unite in our efforts against COVID-19. I'll leave my comments there and I'm happy to take questions.
Are any of the new cases from the Dunedin High School?
No, they're not. So far, most of the tests have come back for the high school students and they are all negative. We're just waiting for the last batch to go through. We'll have those soon and we will update as soon as we've got those.
Are you preparing to lock down the country?
We're preparing to take all the measures we need to ensure that we don't get wider community spread that might overwhelm our health system or put people at risk. So we have shown that we're prepared to act early and act fast and act very deliberately and strongly.
But that's not off the table, is it? Locking the country down?
Well, we've seen other countries do that. When they have tended to do that is when they've got a very high proportion of cases with community spread. Our aim is to prevent that community spread and to do what we need to do to avoid that wider community spread before it starts
What
happening.
condition is that specifically? I'm sure we're all referring to the same thing. Can you specifically address the rumours that we're about to be put into a full shutdown?
Yes, someone mentioned those to me as I was on my way in here, and that's not something that I've heard discussed by anybody.
We understand the Ministry of Health has issued code yellow to some emergency workers. What does that mean?
So we have a series of colours to our information we send out to the wider health system. Up until the last day or two, we've been using what we call a code white, which is really for information. A code yellow is just really to up the level of awareness and preparedness, and so we felt it was very appropriate that we start using a code yellow for our communications out to the system.
How many people are you now contact tracing?
Hundreds. And
not thousands?
It may be over 1,000, but what I can say, of course, you're aware, even just from the one Dunedin student, that was 150 close contacts. So it will be up in the hundreds. Remembering also that for those earlier cases, we're past the 14-day period, so a lot of those close contacts will now be out of self-isolation and carrying on with their lives.
You've got 30,000 tests available to test for COVID-19. Is that going to be enough if we reach a community outbreak? And how are you looking to resource those if we do, in fact, run out?
So there's a lot of work going on to ensure our labs have got the supplies they need, and our health professionals. That includes swabs, it includes everything that the lab needs to make sure they can conduct the tests, and of course that ability to get the results out quickly, identify positive cases, and then do the contact tracing. So that's very much a part of the work that's happening.
How many of the 20 cases of New Zealand have recovered?
How many of the 20 cases? I don't know that for sure, but some of those earlier cases will be completely recovered now, and mostly this illness lasts for a few days. We then ask people to stay in self-isolation for a period afterwards just to make sure they're not infectious.
What condition is that person in hospital in? What sort of condition?
I don't have the details, but this is down in this is one of the cases down in Otago, Southland, and I know that person is on their way to Dunedin Hospital to be looked after there. That was felt to be appropriate.
How long are these waves going to continue if we don't have a vaccine for, say, 18 months?
So what we're planning for is a long-term effort here, because if we manage to successfully prevent community transmission here in New Zealand, but there are other countries that have cases still, we can't keep ourselves locked down for a year. So what we're planning for is a long-term effort here, and that's the preparation we're putting in place.
Do you have the details?
Can you just give a time?
I'm sorry?
Did the Taranaki case attend WOMAD?
No, not that I know of.
Do you have the details of the 2-year-old that was on the flight from New Zealand to South Africa?
No, I don't have any details about that.
Have you done any modelling?
Out of the Imperial College London that's sort of been making the rounds, and what did you make of its implications for New Zealand?
Yes, this is a paper that was published by the Imperial College in London 3 or 4 days ago. It's a group that's been very influential in supporting the UK response. That was very critical in our response over the last few days to inform our shift from flattening the curve to the series of smaller curves, because what they were able to do was identify what measures you need to take to not just flatten the curve, but to keep any outbreaks at a level that your health system can still cope with, and that's the position we want New Zealand to be in.
You say there's no community transmission, but key disease experts are asking if community sample to be tested. Should we be doing that?
So what we've seen over the last few days is a big increase in the number of tests being done. 620 a couple of days ago. Yesterday it was even more than that. I expect it will be even more today. Only a few of those cases are testing positive, but what that does give us a good idea of is if there is wider community transmission. So in effect, we're doing both testing for the disease and some surveillance across the community. We're testing other people with influenza-like illness, and it's not at this point been shown to be COVID-19. So that's quite an important part of informing our response.
Can you clarify whether it costs people to get COVID-19 tested? We heard that someone who was charged for $45 at their GP. Is that just a GP cost?
That would be the GP visit cost, but one of the some of the money in the government that the government announced a few days ago, in the $500 million for health, is to cover the costs of the visit and the testing for all people. So it will be free. We don't want cost to be a barrier to testing if people need it.
Have you done any modelling?
Are any of the new confirmed cases school students, and also what would be the criteria for a school to close?
So of the new cases, none are school students, and we've seen with Logan Park High School that because there was a positive case of a student there, we have closed the school, and we have, in that particular situation, also tested the 150 close contacts. The intention is, if all those tests are negative, then following the school being thoroughly cleaned, it will be reopened next week.
So have you done any modelling as to how Māori will be or could be affected by coronavirus?
We haven't done any modelling specifically for Māori. However, we have done some modelling of what would happen in different scenarios, drawing very much also on and triangulating it with the modelling from Imperial College London.
And what have you discovered?
We've discovered, exactly as the Imperial College folk found, that we can implement a series of interventions that might flatten the curve. Even if we had 2 or 3 times the size health system we have now, that would still be a challenge for us. So our aim is to stop it getting to that point where it's actually where the peak is higher than our health system's ability to respond.
The
to
UK
question.
has asked old people to sort of cut off and self-isolate at home. What is your advice to families visiting elderly, not living in rest homes, but living at home?
Look, the key thing here is to maintain that physical distancing. And first of all, don't visit if you're unwell. So we can protect anybody, including older people. I know we all like to give older folk a hug, but in this case we've just got to get used to maintaining that physical distance. So it's fine to visit, but rigorous about the physical distancing, and not visiting if you are at all unwell with anything. It's a question for that.
When will the Dunedin students receive their test results, and what is the standard test result time?
So we try to turn all the tests around within a 24-hour period, as I said, for those Dunedin students. And I also just want to do a shout out to primary care in Dunedin, who, when the call went out, a number of primary care nurses made themselves available to do all that testing. They set it all up at the rugby stadium there in Dunedin, processed all the students so they could get the swabs done quickly. They all went into the lab yesterday, and we've got most of them back. There's just a final batch being run. The majority have been confirmed as negative so far.
What
the people who have been
projections
tested.
do you have in terms of when are we going to hit a community spread and community outbreak? What are your projections?
So we are watching very closely as to whether we've got any community spread, and that's exactly what we're trying to avoid. And we're also being prepared to act before we see any evidence of widespread community outbreak.
The people who've been.
I don't have a rough time.
What are
the people who've
still running? DHBs are still running elective surgeries.
Yes.
Is there a case to be made for stopping that, or at least scaling it back in anticipation of needing that capacity in the near future?
Sure. We can scale back elective surgery quite quickly because a lot of elective surgery now is day of surgery admission and also day stay surgery, or people have very short lengths of stay. Some elective surgery is being postponed so that we can train the staff who operate the theatres and the post-op area in this process of looking after patients who are being ventilated. So that's already happening, and we're looking closely over the next 2 days about which specialties. For example, some specialties it's very much day stay surgery, and we can just do that and turn that off quite quickly if we need to. So we're looking at all the different specialties or surgery that require longer periods in hospital. Those are the ones that we would move to switch off first.
Considering more than 600 people have been tested, are they likely to get a refund? That's a lot of money for low-income families and people.
Sorry, which people?
For the low-income people, or just people in general
who have been tested and have paid for it.
Yeah.
No, we won't be looking to refund that, but we will be. So the cost would have been just the regular cost of a GP visit. If someone has a community services card or attends a very low-cost access practice, the cost of the co-payment is less than $20. But obviously now we've moved to make sure cost is not a barrier for anybody.
Are there any plans to get the Defence Force involved in any capacity?
Well, the Defence Force is already involved in the planning, and they're part of our cross-government effort. And we had a discussion yesterday about, for example, the medical, nursing and medics staff in the Defence Force. Their primary focus is on keeping the Defence Force well and working, and obviously there may be a time when we need to deploy the Defence Force. They're very much part of the planning.
What is the advice?
Final question here.
When do you start testing health workers?
You mean automatically just testing health workers?
Yeah, like health workers that have been exposed to the virus. They're obviously the front line,
Yes.
testing people every day. They're bound to get exposed. When do you start testing them? Before they're symptomatic? Or?
Yeah. So what we do, of course, is if any health worker is exposed and may have been at risk because they weren't wearing PPE or because they were a close contact, for example, of someone outside of the healthcare setting, then they go into self-isolation and we watch for symptoms. We're not routinely testing every health worker if they've cared for or looked after a person with COVID-19, because of course we have PPE and they use that PPE to prevent becoming infected.
Should we stop flights to Samoa? It's a country still recovering from the measles crisis.
Quite, and I know there's interest in, because there's been a reported suspected case in Samoa. We're watching that very carefully, and we're looking very closely at the situation in the Pacific, traffic both to the Pacific and back this way. So that's something that's under active consideration. I'm just going to leave it there because I've just got other commitments to go to, but thank you very much again for attending and for your interest.
Thank you.
Thank you.
Our economy. And so I've suggested some fairly large